We were just out riding four-wheelers one night, and I ended up wrecking my four-wheeler, broke my T12 and T11, got transported to Shannon for about a week, and then showed up here to work with Mary, and brings us to here.
Just say your first and last name. Say my name as well.
Maverick Moody.
When I first met Maverick, he was limited by a TLSO, or thoracolumbar sacral orthotic, limiting a lot of his movement and mobility. And that was pretty frustrating initially because there were a lot of things that we were trying to teach him to do, and we would have to say, this will be easier when this comes off. So being able to introduce something like the exoskeleton is kind of like shining that light at the end of the tunnel earlier in the rehab process.
This technology would change Maverick's rehabilitation process by giving us a lot of different things that we can work on that are quite impossible when you just have two hands from a physical therapist, but allowing him to expand his walking ability and work on gaining strength into different muscles.
The exoskeleton, I mean, by far felt normal. I mean, everything else that you have so far is you're in a harness and you're just, is by far the most normal thing of getting back to walking. Be able to stand up on your own and not have somebody right there moving you left and right, and you can actually get some more independence out of it.
When Indego said they had their criteria for what types of things that patients had to have in order to get into the exoskeleton, there is criteria that you have to meet. And so we went through and we looked at our current patient population, and Maverick and his family, they've been very forward thinking with what they want to do, how they want to get involved with what technologies are out there. After a spinal cord injury, the first thing that patients want to work towards walking. My brother had a spinal cord injury when I was really little. He was 17. Walking was the goal. This technology wasn't out there at that time. It gives patients hope, I think, where the world is progressing.